Hey everyone. I get the feeling you folks like to be prepared, for just about anything.
I think we all like to feel a little bit more in control when something unexpected happens.
Exactly. So today we're going deep on 10 life-saving medical tips every family should know. Think of this as a little toolkit to help you feel a bit more confident in a sticky situation.
But of course, remember, we're not medical professionals.
Right. These tips are never a replacement for calling 911 or your local emergency number.
Those are the real heroes. But while you're waiting for them to arrive, there's a lot you can do.
That's what I love about this. The first tip that really jumped out at me was about recognizing a heart attack. I think, we've all seen those movie scenes where someone clutches their chest dramatically, but I have a feeling it's not always that obvious in real life.
You're right. Sometimes the signs can be a lot subtler, like you might feel pressure or pain in your chest that spreads to your arm, your neck, or even your jaw.
Okay, yeah, I've heard about that spreading pain. But honestly, what surprised me was that nausea or cold sweats could be a sign of a heart attack. I always thought those were, signs of the flu or something.
It's easy to mistake them for something else. But it's important to remember that everyone's body reacts differently, and those less obvious symptoms can be just as important. And with a heart attack, time is of the essence.
Yeah, the faster you get help, the better the chances, right? I've heard that phrase, time is muscle, but what does that actually mean?
So it means that every minute that passes without treatment means more heart muscle is being damaged.
Wow, that's pretty powerful. So even if you're not sure, it's always best to call for help if you have any of those symptoms.
Exactly. It's better to be safe than sorry. Now let's talk about the recovery position.
Okay, the recovery position. I have to admit, the name sounds a bit formal, maybe even a little intimidating. What's it all about?
So think of it this way. You've got someone who's unconscious but still breathing. The recovery position is all about making sure their airway stays open. It helps prevent them from choking on their own tongue or if they, vomit.
Oh, that makes sense. So how do you actually, get someone into this position?
So you want to roll the person onto their side, making sure their top leg is bent so they're stable.
Okay, so they're on their side, leg bent.
Then you take their bottom arm and kind of stretch it out in front of them.
Okay.
And then put their top arm across their chest. And here's the most important part. Tilt their head back just slightly, just enough to keep that airway open.
Got it. So it's all about stability and free breathing. When would you actually use this, though?
Oh, there are lots of situations where it could come in handy. Someone faints or maybe they have a seizure. Even with a head injury, anything where they're unconscious but still breathing.
That's good to know. Definitely something to keep in mind. All right, moving on to wound care, which I think we've all had to deal with at some point.
I bet you have some stories there.
Oh, let's just say I'm not exactly known for my grace. Tripping over thin air, that's my specialty. But, I've had my share of scrapes and cuts, and I've always relied on the Ricey method.
Rest, ice, compression, elevation. A classic for a reason. But there's another part of wound care that people often forget about, and it's just as important as those 4 steps.
Oh, what's that?
Irrigation.
You mean cleaning the wound, right? Sometimes I'll admit I've been a little lazy, just a quick rinse and slap on a bandage.
Well, rinsing is good, but proper irrigation means really getting in there, getting rid of any dirt or little bits that might be stuck in there, things that could cause an infection. Think gentle scrubbing with soap and water, or even better, using a saline solution to really flush it out.
Okay, so more than a quick splash. Got it. Is there anything else we should keep in mind when dealing with wounds? Like, when should you actually go see a doctor instead of just doing it yourself?
So 2 things to keep in mind. How long it's been bleeding and how bad the bleeding is. If you've been applying pressure for 10 or 15 minutes and it's still bleeding, or if the wound is deep or spurting blood, it's definitely time to get professional help.
All right, makes sense. Let's move on to another common issue. Fevers. Everyone gets them, but when does a fever become something to worry about?
That's a great question. You're right, fevers are usually just our bodies fighting off an infection, but sometimes they can signal something a bit more serious. For adults, if your temperature gets above 103 degrees Fahrenheit, that's a sign that you need to pay attention.
So 103 degrees, that's the number to watch. And what should you do if you actually hit that temperature?
First things first, try those simple at-home things like a lukewarm compress or just making sure you're staying hydrated. Those can work wonders.
Okay.
You might also want to consider taking an over-the-counter fever reducer. But it's always a good idea to check with your doctor or pharmacist first, just to be safe. especially if you're taking other medications.
Okay, so simple steps first, and then check with a professional if needed. What about for kids? Is that 103-degree rule the same for them?
Well, with kids, fevers can be a bit more tricky. The guidelines are actually different depending on how old they are. So if
Hmm.
you're ever concerned about your child's fever, the best thing to do is just call your pediatrician. They can give you the best advice for your specific situation.
Good advice. When it comes to fevers, especially with kids, a little caution never hurts. Now, let's talk about something that can be really scary: choking.
I know, right?
It's definitely a situation where knowing what to do quickly can make all the difference.
Absolutely. And that's where the Heimlich maneuver comes in.
The Heimlich, yeah. I've heard of it, of course, but I've never actually had to use it. What's the most important thing to remember about it?
The key is to apply quick upward thrusts right below the rib cage. It's all about using force to try and dislodge whatever's blocking their airway.
I see. So it's not about being gentle, it's about using force in the right place. What if someone's choking and they're alone? Is there anything they can do?
You know, there actually is. There's a way to perform the Heimlich maneuver on yourself.
On yourself?
Yeah. You can use a chair or a countertop to apply those upward thrusts to your own abdomen. It's not ideal, but if you're alone and choking, it's definitely better than nothing.
Wow, I never knew that. You learn something new every day. All right, now let's talk about strokes. Have you ever heard of the acronym FAST? I think I have, but I can't quite remember what it stands for.
FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. It's a super helpful way to remember the key signs of a stroke.
Oh, right, I knew it sounded familiar, but why is time so important when it comes to a stroke?
Because, just like with a heart attack, every minute without treatment causes more damage. And in this case, we're talking about brain cells. So that phrase, time is brain, really is true.
Wow, that's a sobering thought. So if you see even one of those fast symptoms, you call 911 immediately. No waiting to see if it gets better.
Exactly. Getting help quickly can make a huge difference in their recovery. Now, what about severe allergic reactions? Let's say someone's having a really bad reaction, maybe to a bee sting or peanuts. What's the most important thing to do?
In those situations, an epinephrine autoinjector can literally be a lifesaver. Those are things like EpiPens, right?
Yeah, exactly. You want to make sure you know where to find it and how to use it.
To be honest, I'm not exactly sure how they work. Can you walk me through it?
They're designed to be really easy to use, which is good in a stressful situation. You just remove the safety cap, hold it firmly against their outer thigh, and press down until you hear a click.
Okay.
Hold it there for a few seconds, then remove it and massage the area. And don't worry about taking off their clothes. It injects right through clothing.
That's good to know. So anyone can use it? You don't have to be a doctor or anything?
Nope. And after you've given them the epinephrine, call 911 right away.
Got it. EpiPen first, then call for help. What else should you do when someone's having a bad allergic reaction?
Try to stay calm. It can be scary to see someone going through that, and your calm can help them stay calm too.
So EpiPen 911 and stay calm.
Got it. Okay, let's talk about burns. What's the first thing you should do if someone accidentally touches a hot stove or spills boiling water on themselves?
It's actually a common mistake to immediately put ice on a burn.
Really? I thought cold was the way to go.
Well, using something too cold can actually hurt the skin even more. What you want to do is cool the burn with cool, not freezing cold, running water. Do that for 10 to 20 minutes. It helps stop the burning process and reduces swelling, but without doing more damage to the skin.
Cool water, not ice water. Got it. Are there any other things you shouldn't do when treating a burn?
Whatever you do, don't pop any blisters that form. They're actually there to protect the skin, and popping them just makes it easier for an infection to start.
Okay, let those blisters do their thing. And I'm guessing that with really bad burns, you always want to see a doctor, right? Absolutely.
Yeah.
If it's a large burn, a deep burn, or if it's on a sensitive area like the face, hands, or genitals, call 911 right away.
Good to know. Okay, let's switch gears and talk about something we all experience: dehydration. Remember that summer hike where I forgot to bring enough water?
You were looking a little parched that day.
Oh, I was beyond thirsty. My mouth was so dry, my head was pounding, and I was completely wiped out.
Sounds like you were definitely dehydrated.
Yeah.
It happens when your body loses more fluids than it's taking in. And, it can be really mild or really severe.
So it's more than just feeling thirsty. What are some signs that someone might be dehydrated?
Well, you definitely got the dry mouth part right. But you might also see things like dark-colored urine, going to the bathroom less often, feeling tired or dizzy, or even having headaches.
It's crazy how much our bodies depend on getting enough fluids. So what's the best way to treat dehydration besides, the obvious, drinking water?
Drinking water is key, for sure. But you don't want to just chug it all at once. Sip it slowly so your body can absorb it better. And sometimes, especially if you've been sweating a lot or you've been dehydrated for a while, you need more than just water. You need to replace those electrolytes too.
Electrolytes, right. Those are the things that help our bodies work properly, but what do they have to do with dehydration?
They're actually really important. Electrolytes, things like sodium and potassium, help your body hold on to water. And when you sweat, you lose electrolytes. So if you're dehydrated, you need to get those back too.
So it's not just about the water, it's about those other minerals too. Okay, that makes sense. Now let's talk about something everyone should have at home, an emergency medical kit. What are the must-haves?
You want to think of it as your mini first aid station. You'll need the basics, like bandages, antiseptic wipes, antibiotic ointment, gauze pads, pain relievers, and a thermometer.
Okay, so the basics for cuts, scrapes, and fevers. What else?
Don't forget a list of important phone numbers. Your doctor, poison control, anyone you might need to call in an emergency. It's also smart to have a list of allergies and medications for everyone in your family, just in case someone else needs to help them.
That's a good point. I hadn't thought of that. Having all that information written down could be really helpful.
Absolutely. And don't forget a flashlight with fresh batteries, especially if the power goes out during an emergency. And it's always good to have some over-the-counter meds on hand, things like antihistamines for allergies, antacids for heartburn, maybe some cough and cold medicine.
I have to admit, my emergency kit is pretty pathetic right now. It's basically just a box of Band-Aids and some old sunscreen.
Well, you're not alone. But having a well-stocked kit can make a big difference. And one last tip. Remember to check your kit regularly and replace anything that's expired or doesn't work anymore.
Oh yeah, I've definitely been there with dead flashlight batteries.
Yeah.
Not fun. This has been so helpful. I already feel so much more prepared. And I know we've only just scratched the surface.
Welcome back to our deep dive on these life-saving tips. We've covered a lot, but there's still so much more to go.
It feels like we're building a medical superhero skill set here. But speaking of things that can be scary, let's talk about seizures. I honestly wouldn't know what to do if I saw someone having one.
Seizures can be frightening, that's for sure. But there are some simple things you can do to help.
Okay, good to know. Like what?
Well, the most important thing is to keep everyone safe, the person having the seizure and the people around them.
Okay, safety first. How do you actually do that?
Well, first, clear some space around them. Move any furniture or anything they could bump into.
So create a safe zone. What about holding them down? I've always heard you're not supposed to do that.
You're right. Never restrain someone during a seizure. It can actually cause more harm. Their body's moving involuntarily, and trying to stop those movements could hurt them.
So clear the area, don't hold them down. Got it. What else?
If you can, try to cushion their head. A pillow, a jacket, even your lap if there's nothing else. It helps protect their head if they hit something.
Okay, that makes sense. Anything else you can do during the seizure, or should you just kind of wait for it to be over?
Stay with them and watch what's happening. And if you can, try to time how long the seizure lasts.
Time the seizure. Why is that important?
Because knowing how long it lasted can help doctors figure out what kind of seizure it was and what might have caused it.
So it's all about information for the doctors later on. Okay, so stay calm, keep them safe, cushion their head, don't hold them down, and time the seizure. What about after the seizure stops? What should you do then?
Once it's over, gently roll the person onto their side, into that recovery position we talked about earlier.
Ah, the recovery position. So it really is a superhero move, useful for all sorts of situations.
Exactly. It's all about keeping their airway open. And even if they seem okay afterwards, it's always a good idea to call 911. Sometimes seizures can be a sign of a bigger medical problem.
Okay, great advice. I'm feeling a lot more confident about handling a seizure now. Now, how about nosebleeds? They always seem to happen at the worst possible times.
A lot of people think you should tilt your head back during a nosebleed, but that's not actually the best thing to do.
Really? I've been doing it wrong this whole time.
Yeah, if you tilt your head back, the blood can actually run down your throat, which can make you choke or even throw up. Not fun.
Yuck. No thanks. So what should you do instead?
It's pretty simple, actually. Lean forward and pinch the soft part of your nose.
Yeah.
Just below the bony part.
Lean forward and pinch. Got it. How long do you have to do that for?
Hold it for about 10 to 15 minutes, keeping that pressure on the whole time. You can also try putting a cold compress on the bridge of your nose. That can help too.
So constant pressure, cold compress, good to know. What if it just keeps bleeding, even after 15 minutes?
If that happens, you should probably see a doctor. There might be something else going on that needs to be checked out.
Okay, that makes sense. Now, I have a question about a skill I've always wanted to learn. CPR. It seems a bit intimidating, though. Is it something anyone can learn?
Oh, absolutely. There are CPR classes offered all over the place,
Mm-hmm.
usually by organizations like the American Heart Association or the Red Cross. It's a really important skill to have. It could help you save a life someday.
I always thought it was something only doctors and nurses could do. What are the basic steps involved?
So CPR involves chest compressions, giving rescue breaths, and using an AED if there's one available. That's an automated external defibrillator.
Chest compressions, rescue breaths, AED. Okay, gotta learn that. But what if you're alone and you start choking? Can you do the Heimlich maneuver on yourself?
It's definitely better to have someone else do it if you can. But if you're by yourself, knowing how to do a self-Heimlich maneuver could save your life.
Wait, how does that even work? It seems impossible.
There are a couple ways to do it. One is to use a chair or a countertop. You make a fist and put it just above your belly button, and then you kind of quickly thrust your stomach against the edge of the chair or countertop.
Wow, okay. Sounds intense. But I guess if you're choking, you'd try anything, right?
Right. There's also a way to do it with your own fists. You make a fist and put it above your belly button, then grab that fist with your other hand and push upward and inward like you would if you were doing it on someone else.
So you're using your own body weight to create the force. That's pretty clever. Okay, what about broken bones? I've never broken a bone, knock on wood, but I know it can happen really easily. What should you do if you think someone might have a fracture?
The most important thing is to keep the injured area from moving, to prevent further damage. And that's where splinting comes in.
Splinting? That sounds like something you'd do in the wilderness.
It might sound that way, but it can be just as useful in everyday life. Imagine someone falls while hiking, or, a kid breaks their arm playing sports. Splinting can really make a difference.
Okay, how do you actually splint a broken bone? Do you need, sticks and stuff?
It's not as complicated as you might think. You just need something rigid to act as a splint. A piece of wood, a rolled up magazine, even a sturdy branch, if that's all you've got.
Mm.
Then you carefully put the splint next to the broken bone, so it keeps the joints above and below the break from moving.
So, if it's a broken arm, you'd splint from the elbow to the wrist.
Exactly. And then you use whatever you have to secure the splint in place: bandages, tape, a scarf, a belt, anything that'll hold it still.
So, immobilize, secure, and then...
And then get to a doctor or a hospital as soon as you can. Splinting is just a temporary fix until they can take a closer look.
Makes sense. This is all so helpful, really practical stuff you can use in real life. What else should we add to our medical toolkit?
Let's talk about ticks.
Oh, no, ticks. I hate even thinking about those little guys.
Yeah, they're not exactly pleasant. But it's important to know how to remove them properly because they can carry some nasty diseases, like Lyme disease.
I've heard you're not supposed to just pull them off with your fingers. Why is that?
That's right, you shouldn't. If you squeeze or pull a tick too hard, its mouth parts can actually break off and stay stuck in your skin, and that can cause an infection. You want to make sure you get the whole tick out.
Okay, no squeezing or yanking. So what's the best way to remove a tick?
Fine-tip tweezers are the best tool for this job. Grab the tick as close to the skin as you can and pull straight up, nice and steady. No twisting or jerking, just even pressure.
Got it. Steady and even, like a pro. What should you do with the tick after you get it out?
It's actually a good idea to save it just in case you need to have it tested for diseases later. Put in a little container or a baggie. Then wash the area where it was attached really well with soap and water and put on some antiseptic.
Okay, makes sense. And I'm guessing that if you start feeling sick after a tick bite, you should definitely see a doctor, right?
Absolutely. It's always better to be safe than sorry. Now, how about something a little more familiar? Sprains and strains.
Ugh. I swear I sprained my ankle just getting out of bed this morning. Just kidding. But they always seem to happen at the worst times. What's the best way to deal with them?
Remember that RICE method we talked about for wound care?
Rest, ice, compression, elevation. It's coming back to me now.
It works for sprains and strains too. Rest the injured area, ice it to bring down the swelling, use a compression bandage for support, and keep it elevated to help the fluids drain.
Pamper that injury, basically.
Exactly. And if it hurts, you can take some over-the-counter pain relievers. But if the pain is really bad, or you think it might be broken instead of just sprained or strained, or if it doesn't get better after a few days, it's time to see a doctor.
Good advice. I'm loving all these helpful acronyms. This deep dive has been so eye-opening. I feel much more prepared for whatever life throws my way now. We're back! I can't believe how much we've learned already. It feels like we've covered everything, but I know we still have some more to explore.
We've definitely touched on a lot of common medical situations, but, sometimes life throws you a curveball.
Okay, so what kind of curveball are we talking about now?
What about snake bites?
Snake bites. Honestly, that's something I always thought only happened in movies or, if you're out in wilderness somewhere. Not something I'd have to worry about in my everyday life.
You're right, they're not super common for most people. But knowing what to do if you or someone you're with gets bitten, well, that could be really important.
Okay, you get my attention. What's the first thing you should do?
First things first, stay calm and get medical help as quickly as possible. Call 911 or get to a hospital fast.
Okay, stay calm. Call for help. But what about while you're waiting for the paramedics to arrive? Is there anything you should do or maybe things you shouldn't do?
There are definitely some do's and don'ts when it comes to snake bites. The most important thing is to try and keep the bitten area still and lower than the heart if you can. That can help slow down the spread of the venom.
So no running around like a crazy person or trying to suck out the venom.
Exactly. That's just movie stuff. And don't use a tourniquet either. That can actually make things worse. The best thing you can do is get professional medical help. They can give anti-venom if it's needed.
Got it. Immobilize, no DIY venom removal, and get to the hospital fast. Okay, good to know. Now, how about something that I think we've all dealt with at some point? Eye injuries.
Yes.
Yeah.
Eye injuries. They can be anything from a little speck of dust to something much more serious.
Exactly. And they always seem to happen at the worst possible time. So what are the basics of eye first aid?
The most important thing is don't rub your eye.
That's tough. It's like an automatic reaction if something gets in your eye. Why is it so bad to rub it?
Well, rubbing your eye can actually make the injury worse. And you can also introduce bacteria, which could lead to an infection. If you've got something in your eye, like dirt or sand, try to gently flush it out with clean water.
Okay, so flushing with water is a good first step. What if the thing in your eye is really stuck, though? Should you try to get it out yourself?
No way. If something is embedded in your eye, don't try to remove it yourself. Just cover the eye with a clean cloth or gauze pad and get to a doctor right away.
Okay, so water for loose stuff, hands off for anything embedded. What about if you get chemicals splashed in your eye? Those seem especially scary.
Chemical splashes are serious. You need to act fast. Immediately flush your eye with cool, clean water for at least 15 minutes. Don't wait, just start flushing. Then get to a doctor as soon as possible.
So flushing is the key here.
Yeah.
Got it. Any tips on preventing eye injuries in the first place?
Always wear protective eyewear if you're working with power tools, chemicals, or anything that could send debris flying towards your face. It's a simple thing that can make a huge difference.
Good advice. Now, for our last tip today, let's talk about something that can be really intense: panic attacks. I've known people who have experienced them, and they sound terrifying. What can you do to help someone who's having a panic attack?
Panic attacks can feel like the world is ending. So your job is to help them feel safe and grounded. And the first step is to stay calm yourself. If you're freaking out, it's just going to make things worse for them.
Oh, even if you're feeling a little panicked on the inside, stay cool on the outside.
Exactly. Let them know that you're there for them, that they're safe, and that this will pass.
Okay, so reassure them. What else can you do?
Help them slow down their breathing. Deep, slow breaths can help regulate their heart rate, which usually goes crazy during a panic attack. You can even breathe with them, kind of guide them through it.
That's a great idea. Is there anything else you can do to kind of distract them from the panic?
You can try to help them connect with their senses. Ask them to describe what they see, hear, smell, and feel around them. It can help bring them back to the present moment and away from the scary thoughts and feelings.
Okay, so create a calm environment, encourage deep breathing, and focus on their senses. What if the panic attack is really bad, or it doesn't seem to be stopping? Should you call for help?
While panic attacks themselves aren't usually an emergency, if someone is having trouble breathing, or if it's going on for a long time, it's best to err on the side of caution and get medical attention. And it's important to remember that panic attacks are treatable. There are therapies and medications that can help manage anxiety and prevent future attacks.
This whole deep dive has been amazing. I feel like I've learned so much valuable information today.
Me too. And remember, knowledge is power, especially in an emergency. By knowing these tips, you might be able to help yourself or someone else in a critical situation.
That's so true. I'm feeling much more confident and prepared now. To all our listeners out there, thanks for joining us on this deep dive. Remember to check out the source material for more information and share what you've learned with your family and friends. Stay safe, everyone.